A lot of people wondering when on earth schools are going to start to reopen. Can you give us a date, a time of when schools can start to reopen for all children?
The first thing I want to say is just a massive thank you to all the parents who've been looking after their kids at home in the last few weeks. I know how stressful it has been. I know what the pressure people are under since the new year, and it has been going on. I must tell you, it will go on a little bit more. We're going to be looking at where we've got to on the 15th of February, where, as you know, we hope to have vaccinated about 15 million people across the whole of the UK. The JCVI groups 1 to 4, the real priority groups, will be deciding before then whether we can be getting schools back. But I can tell you that daily we're looking at the data and trying to work out when we're going to be able to lift restrictions. Schools obviously will be a priority, but I don't think anybody would want to see the restrictions lifted so quickly whilst the rate of infection is still very high, so as to lead to another great spread of infection. We've now got the R down below 1 across the whole of the country. That's a great achievement. We don't want to see a huge surge of infection just when we've got the vaccination programme going so well and people have worked so hard.
Can we rule out schools then reopening to all children before Easter? Will they be open before Easter?
I understand, Dan, why people want to get a timetable from me today. What I can tell you is we'll tell parents, tell teachers as much as we can, as soon as we can. We'll be looking at the timetables, we'll be looking at all the predictions about the numbers of people we'll have vaccinated, the effect that has on the risk to the whole population, just how fast we can go, but how fast we can go in a responsible and cautious way. Because I do think now this massive achievement has been made of rolling out this vaccination programme. I think people want to see us making sure that we don't throw that away by having a premature relaxation and then another big surge of infection.
Some of your own MPs are accusing you and the government of forgetting about schools. When I ask you whether schools will be open before Easter, you can't answer it. They'll assume that means they won't be open before Easter.
No, you mustn't assume that. If I may say so.
But MPs and parents and teachers want to know a rough plan here, Prime Minister, and they have absolutely no idea when schools are going to reopen. Is that the situation you're in? You just have no idea when they're going to reopen?
Well, we're looking at the data as it comes in. We're looking at the rates of infection. As you know, the JCVI groups 1 to 4 are going to be vaccinated by the 15th of February. Before then, we'll be looking at the potential of relaxing some measures. But don't forget that this country has made huge progress in reducing infection. I don't think people want to see another big surge in infection. I totally understand the frustrations of parents, and I really thank teachers for what they're doing and the immense efforts that they're going to teach kids online, and the government has provided a lot of laptops, 1.3 million laptops. I know that's no substitute for direct face-to-face learning. Believe me, Dan, there's nothing I want to do more than reopen schools. I fought to keep schools open for as long as I possibly could. We want to see schools back. We want to see them back as fast as possible. We want to do that in a way that is consistent with fighting the epidemic and keeping the infection rate down.
One of the issues, obviously, this week for you will be the borders, controlling the borders, seeing who comes in and leaves. One of the arguments is for a quarantine hotel. Can you confirm that quarantine hotels is something that you're actively looking at?
We're definitely looking at. But I've got to tell you, at the moment, the UK already has one of the tightest regimes in the world. So don't forget, everybody, when you're coming into the UK, coming back from the UK, you have to have a test 72 hours before you fly. You have to have a passenger locator form. The airline will kick you off if you don't produce either of those, a negative test or a passenger locator form. And then you've got to quarantine for 10 days or 5 days if you get another negative test. But with this vaccination program, we've done, I think, 6.4 million people now in the UK as a whole. We are on target, we're on target to hit our ambition of vaccinating everybody in those vulnerable groups by the middle of February. It's an immense effort by the NHS. If we're going to make that effort, which we are, we want to make sure that we protect our population, protect this country against reinfection from abroad. So that idea of looking at hotels is certainly one thing that we're actively now working on.
Would that include all people coming from the UK or from certain countries, or would it include Brits as well?
We need a solution that gives us the maximum possible protection against reinfection from abroad, because it doesn't take, you can see the risk, which is that we can do an amazing job of vaccinating our population. We have to realise there is at least the theoretical risk of a new variant that is a vaccine-busting variant coming in. We've got to be able to get that under control.
Actually, one final question. The First Minister of Scotland yesterday said she'll hold an advisory referendum whether Westminster consents or not. Would you challenge the Scottish Government if Nicola Sturgeon tried to hold a referendum?
I just think I made a couple of points on that. This country is going through a pandemic. The whole UK is going through a pandemic. I think what the people of the Kingdom want to see is everybody focusing on beating that pandemic, which we are, rolling out the vaccine and getting ready to bounce back from that pandemic and have the strongest possible economic recovery. That's the priority for the whole of the United Kingdom. I think people also can see everywhere in the UK the visible benefits of our wonderful union. A vaccine programme that is being rolled out by an NHS, a national health service, a vaccine that was developed in labs in Oxford and is being administered by the British Army. So I think the strengths and advantages of the union speak for themselves.